Hello, my name is Michael Gross. I am a urologist. I work for Urology Clinics of North Texas, and I hope this short video will help answer some questions that you may have about vasectomy.
A vasectomy is a procedure that a man can have when him and his wife have decided they no longer want to have any more kids, and they're looking for a permanent solution, not a temporary solution, but a permanent solution, which is always an important thing to consider. So before committing to a vasectomy, it's extremely important that you've discussed it with your wife and you've made certain that this is what you want to do.
Anybody is a good candidate for a vasectomy. This is a very simple office procedure. It takes about 8 minutes. It's done under local anesthesia, so really there's not many conditions that would preclude somebody from being a good candidate for a vasectomy.
It's important to understand the normal male anatomy when you're preparing for a vasectomy so you can understand how a vasectomy works and how the procedure is performed. The testicles are what makes your sperm, and they lie in the scrotum. There's two of them, one on the left and one on the right. That's where sperm are formed, and they collect in the epididymis, which is behind the testicle, and mature in the epididymis. And then they travel up through the vas deferens on both sides towards the prostate and the seminal vesicles, and then out the urethra and out through the penis on their way.
The sperm is mixed with fluid from the prostate and the seminal vesicles, and this fluid actually carries the sperm into the female.
So the procedure is performed in the office almost exclusively. It's generally a very quick 10 to 15 minute procedure done with local anesthetic, and it's very, very well tolerated.
So first of all, we administer the local anesthesia, and then we either make one small incision in the scrotum or two small incisions. We bring the vas up to the skin, then we usually remove a segment, usually a ½ inch to an inch in length, and then on these free ends, we'll put a surgical clamp to seal the end. And then just to make sure, we'll cauterize the end as well. Once we've done this, we allow the vas to go back into its normal position, and then we put a dissolvable suture in the skin.
When we inject the local numbing medicine, there's a little poke and burn at first, but after that, there's usually very minimal pain. There can be some discomfort with manipulation, kind of like you sat on them a little bit wrong, but there's very, very mild pain, and it's a very well tolerated procedure. So the day before the morning of the procedure, you should shave your scrotum. You can do this in the shower with a razor. You don't need to make everything perfect, but it's important to get most of the hairs off of the front of the scrotum.
We'd actually rather you eat and drink before the vasectomy. You don't need to come in on an empty stomach.
Make sure you buy a jock strap or some very tight boxer briefs, something to give you a lot of support to bring to your appointment with you, because you're going to want to wear those home.
The only thing that's really important is try not to use any blood thinners for the 10 days leading up to a vasectomy, things like aspirin, Advil, Aleve, Motrin, ibuprofen.
If you need any medicines for pain, Tylenol is a safe alternative. Right after the procedure, you should go home and sit on the couch. You don't have to stay bedridden all day long, but it's important to stay off your feet. Go to the bathroom, get yourself something to eat, get yourself something to drink, but try to take it easy. And as soon as you get home, put ice on your scrotum.
½ hour to an hour on, ½ hour to an hour off for the rest of the day.
Ice is your best friend. It will dull the pain more than anything else you can take. If you need anything, ibuprofen and Tylenol are usually all you need.
That night, you can just go to sleep. You don't have to balance ice. And then the next day, we recommend the same thing. Just sit around the house, ice hour on, hour off.
After the first day and a half, you can resume normal activities to a certain extent. You don't want to go to the gym, you don't want to lift weights, no bicycle riding, horseback riding for that first week, and you don't want to have sex for that first week because it can hurt. And then after the first week, you can get back to normal activities as tolerated.
So when can you go back to work? The day that you have it and the next day, we really want you to relax. The day after that, if you have an office type job, you can certainly go back to work.
You don't want to go back to work for a week if you do something extremely strenuous, such as a firefighter or a police officer. But if you work at a desk job, you should be more than capable of going back after a couple of days. Just like any procedure, there are certain risks to understand before you move forward with a vasectomy. And although these risks are extremely uncommon, they can happen.
This is a very simple procedure done in the office. You may have a little bit of bleeding. It's possible to have a superficial infection, though it's rare. That's usually controlled with a simple course of an antibiotic.
And failure can happen. Occasionally patients will get a small lump at the site of the vasectomy called a sperm granuloma, and occasionally they'll have an infection that requires antibiotics.
Some people will have some prolonged discomfort in their testicles, but it usually goes away within a couple of weeks.
After the procedure, you can still get somebody pregnant, and it's important to wait and have your semen checked on 2 occasions to make absolutely sure that there are no swimming sperm left behind. There will actually be several sperm that are still upstream of where the incision is made, and it takes several weeks for those to make their way out.
Theoretically, after a few ejaculations, you're probably not going to cause a pregnancy.
After about 5 to 6 weeks, we'll have you bring in a sample on 2 occasions. We'll look at them under the microscope and make absolutely sure there's no swimmers left behind so you don't have an accident happen.
Once you've had your 2 negative consecutive semen analyses, you really don't need to come back for follow-up. This is not something that's going to fail later down the line.
So there are several things you cannot expect after a vasectomy. Your testosterone won't be affected. Testicles are still going to function completely normal, and your level of testosterone is not going to change. Also, your sex life isn't going to change. Your erections will be the exact same, your sensation will be the exact same, and your orgasms will be the exact same. The sperm actually make up only about 1 or 2% of the semen that comes out, and so you won't even notice a change in the volume of that. One of the common questions that people ask is what happens to your sperm if you cut the pipe out, and your body just absorbs them. They get turned back into normal fluid in your body, and your testicles keep making more. Yes, a vasectomy can be reversed, but it's never 100%, and it's a costly procedure that's not generally covered by insurance.
This is a much more entailed procedure than a vasectomy, though certainly can be done.
So it's very important to make sure that you and your wife have talked about it and that a vasectomy is what you want to do and that it is something that you want to be permanent moving forward.